almost all our beds in Trinidad are filled. Now, in preparedness for the arrival of the Delta variant, the Ministry of Health has been trying our best to upscale or increase the number of intensive care unit beds across the hospitals in our parallel healthcare system. And we did increase on a phased basis by reallocating resources and adding resources the number of intensive care unit beds by 25%. The Honourable Minister indicated this on Saturday. Over the weekend, we again increased capacity to manage the increased demand for beds. But this AM, the demand has exceeded the supply, and this is a factor that Dr. Trotman and myself repeatedly warned the population about. Just for context this morning, I'd like to provide you with actual numbers regarding the number of patients in our hospitals and in the intensive care unit, as well as their vaccination status. So at the Cuba Medical and Multi-Training Facility, we have all 22 beds occupied, so 100% occupancy in the intensive care unit, with 21 of 22 patients unvaccinated. That's 95% of persons at the Cuba Medical and Multi-Training Facility in the ICU that are unvaccinated or not fully vaccinated. At the Arima General Hospital, all 10 beds were occupied in the ICU department yesterday. An additional 2 beds were operationalized based on demand, so all 12 patients in the intensive care unit are not fully vaccinated. At the Augustus Long Hospital, there are currently 10 operationalized or fully staffed beds for intensive care unit patients. 9 out of 10 are occupied. 8 out of 9 of those persons are not fully vaccinated. At the Point Fortin Hospital, 4 out of 4 beds are currently occupied. 100% ICU occupancy. Nil patients vaccinated, fully vaccinated. At the St. James Medical Complex, 4 out of 4 beds for COVID-19 patients in the ICU are occupied. 4 out of 4 not fully vaccinated. And I'd like to reiterate that fully vaccinated means 2 weeks after a 2-dose regime or 2 weeks after a single-dose regime. So this morning, 96% of patients in the intensive care units across Trinidad in our hospitals are not fully vaccinated. We also look at the situation in the accident and emergency departments of our traditional healthcare system. That is the RHA department, San Fernando General Hospital, the Arima District Health Facility, and so on. As of 8:30 a.m. this morning, there were 27 severely and critically ill COVID-19 patients awaiting transfer into the parallel healthcare system. Of those, 9 patients, representing 33%, were of ICU or intensive care unit level. So, in addition to us having reached almost maximum capacity, 9 persons, 9 souls, are awaiting intensive care unit care in the parallel healthcare system and are being ventilated and managed in the accident and emergency departments. Of those 9 persons, none of those souls is fully vaccinated. Ladies and gentlemen, this trend is a serious cause for concern. We have been monitoring these trends over the past month, and we've been appealing to the population to please become vaccinated. Please obtain your vaccine. Encourage persons around you to be vaccinated. We have been trying our best at the Ministry of Health to increase the capacity for ICU beds based on the demand, based on the preparedness for the Delta variant. But a bed is not just a bed. And these beds require staff, equipment, and many other factors. You know, we have to consider the ambulance transfer system as well to transport these critically ill patients that require ambulances that are known as advanced life support units.